Good.
Well, it's 10 o'clock.
Wow, you are.
Donuts to eat too, so make sure you get it.
You brought donuts?
I was in St. Croix with this one.
Do we have anybody on video?
Sabrina is. And then there's some
Joel, leave them.
Can I get you a
tea,
donut?
and then I don't know.
I'm back.
You can have mine.
Joe?
You can have mine for you.
Are these from Uncle Bill?
I don't know.
Do you want to go early or do you want to
Whenever Malia brings up the-
Okay, that's at the end.
It's towards the end.
I was hoping that Mount Prize would be coming in and give him that chair. Can you? No, I don't know. I want this-
It's really bad, hard to sit in.
Because I used to come in my office.
Yeah.
I'd go to-
Why don't you move it up? Joe,
I didn't do
why
it.
don't you move the nuisance up on the agenda after all the preamble stuff? And we'll get that thing here.
No. Thanks, Joe. I don't, I was.
Diana, that's my good luck.
You know, Chief.
Who brought the donuts? That is something. That would be Bill.
Katie wants some cheers.
MVP at the meeting here.
Mm-hmm.
Terry, because did Terry
I'm gonna
not-
vote you,
did Terry
Gigi,
not
out.
twice?
He went twice.
John is not on, so I don't know if you want to start. I don't
That
know.
guy, like.
Just
not
Sabrina.
the lady.
Oh.
And then there's someone named Reed.
Okay, like where are you, right? Okay.
But that's fine.
There's John.
Tomorrow, we should be here.
Only got 5 people.
I
Yeah,
never.
right. Uh-huh.
Whenever.
I thought maybe you're coming like the.
No, but they said you gotta go, just for the heck of it.
Okay, we will call the meeting to order. Health and Human Services and approval of the agenda.
Move.
Second.
All in favor?
Aye.
Carried. Approval of minutes for January 11th.
Make a motion, we approve the minutes for January 11th.
Motion carried. Disclosure of committee members' conflict of interest regarding matters noticed on the agenda. Seeing none? On public comment. Don't see none of that.
None?
Off to a good start. Think of information from supervisors not seated. COVID-19 update.
I'm gonna give that for Jean. She's got a call that she's on with the state. Just takes me a second here to pull it up. So we have good news to report. The CDC has reclassified the levels of, kind of the levels of risk by county, and they are low, medium, and high. And it factors in several different things, number of hospitalizations, number of positive cases, and number of deaths, I believe. So with that information and that formulary, we are in Polk County, I believe we're at a low risk right now, which means, the big thing is masking. That is a personal preference if you mask or not. Things are getting somewhat back to normal. If we would move up to a medium risk, there's a couple of other additional safety precautions that they want you to take. And then if we're high risk, you basically are going back to masking. Our numbers of positives have been fairly low. We're looking at changing up our testing hours. We just don't have the people coming through, so we'll modify that and just play it by ear with the demand coming in. So it's pretty good news, I think, for the COVID report after 2 years of giving you all the high numbers and whatnot. So if there's any questions, I can.
Ask a question.
Yeah.
The boosters, the other day I had those people, but then I have somebody ask me, it's on this floor in the back, right?
Yeah, so they go
Boosters are
right
in
to
this
the,
building.
our community services lobby, which is now on the right-hand side because of the construction. We have our clinics on Thursdays and appointments are strongly encouraged, but we will do our best to try to get people fit in if they do walk in.
And do you have everything still? Moderna, Pfizer?
First doses, second doses, boosters. All I have for the COVID update.
Intro our. Joe, Fran just texted, she is on the phone with me. She's listening.
Who is?
Fran Duncan.
Okay.
Which number is hers? 102, 209?
9102.
We're gonna take and move number 11 next, if that's okay with everybody. Resolution 1122. Resolution supporting the elimination of the Badger Care eligibility.
No.
Wrong,
No, we're doing number 10.
number 10.
Yeah.
Nuisance ordinance. Presentation with discussion and possible action.
I don't think there'll be any action today, but if you recall, a while ago, we were working on rewriting our human health hazard ordinance. And then we started looking into the possibility of creating a nuisance ordinance that would go beyond those situations that rise to the level of a human health hazard. The human health hazard ordinance addresses things like a cat house that has so many cats that it becomes unsafe for humans to live there. But nuisance that went beyond a human health hazard were not addressed, at least by any Polk County ordinance. At the present time, we're looking at specifically housing issues as it relates to some of the notorious places in Polk County, like the hotel on Highway 8 by the Apple River. And when you have a congregation of people that are transitioning out of prison, perhaps you have sex offenders, people that are on the registry in certain places, and then these places are also hotels or motels. And so how does that interact or interface with the rest of the population? What options do we have for warning folks or at least creating some information to discourage places that serve, families and children to have this kind of situation in the same general area? Thankfully, we reached out to Andy Phillips, the WCA General Counsel, and asked about this issue. And now the WCA, on the WCA's dime, is looking into this for all counties in Wisconsin, but at the request of Polk County. What we've done in the interim while they're going to work on that, which I'm very grateful for because that takes a load off of our office. If you look at Chapter 980, that's the sex offender statute, and it talks about what obligations exist when people are transitioning from prison back into the community and they are a sex offender, what obligations the Department of Corrections has, what will happen if there are not places, because there is an obligation for those folks to go back to their county of residence, and then there's definition of county of residence. It's where they were with an intent to remain before they went into this. I also spoke with our local Department of Corrections office and had a conversation with them about what the numbers actually are, how many folks, where they are, how long they stay, what their obligations are. So that's where we're focusing our attention right now. But it doesn't mean any of the other nuisance issues won't also be able to be looked at as we're revamping how we're approaching the nuisance ordinance, because our human health hazard ordinance is antiquated. It needs to be updated. And so we have to do that even if we don't touch these other things. So it seems like the right time to take a look at that. And so we wanted to make that clear to this committee that that's the direction staff is heading in, working with the WCA. And that's where we're headed. Do you have any questions about that? I don't know if Chair Nelson from the
Can I make a
board.
quick comment too, just so you guys might answer some of your questions? This has come up again. As chair, you get more calls from around the county on issues that you do than just as a supervisor for a district. So I've been reached out by a number of municipalities kind of blaming the county for what's happening in their communities, because it's kind of, we used to have the Serenity House next door, and that was a big issue for the village of Balsam Lake too, right? It was so-called a homeless center. But when you looked at it, there was something like 50 or 60 IDs issued to 100 Park Plaza. So it was a way for people to get out of jail. It was a bonding issue. The judges liked that, hey, you can stay here in Polk County, get me an address, and you can make home here, stay here, now you don't have to sit in jail. Well, it's kind of happening all over. So we had a shooting in Balsam Lake here this last year. Guy killed himself, but we had SWAT, we had law enforcement out there because of what's going on at the motel. They're kind of turning into long-term housing. They're not really motels. We license them as motels, but these new owners, and with the economy today, they're having to do other things to generate income. We had another shooting like a year or two ago down in St. Croix Falls, same kind of situation at the Dallas House motel. And what we're hearing from these communities is, how do we let everyone know how unfair it is for a tourist to pull into Polk County? Polk County licenses it as a motel, but yet there's some guy living in the back room and your kids are going swimming in the pool and you got some criminal, whether he's a sex offender, whatever he is. So I think the idea is how do we, not that we say, hey, we need places for people with mental health issues. We need places for people to stay. But how do we inform the public? We require in this county for a tourist rooming house. So if you want a cabin on a lake, you have a licensing process to allow people to come stay at your house on the weekends, and you rent it out. The neighbors know you have it. County knows you're operating a business there. And so I think the big request and broad is, how do we help out the villages, not just the counties, but a broad, like a nuisance ordinance, or whether it could be a housing ordinance or whatever it is, that there's a process that it's fine. If you want to be a motel, but you also want to have long-term stays there, or you want to get dollars from the Department of Justice or the corrections or whoever funds these so-called homeless shelters, that we know that that's what they are, and maybe a CUP process to where even a village would know, hey, there's someone applying for a long-term housing here, not just a motel, that there's a process that the public knows and that tourists would know. If I'm pulling into Balsam Lake and I'm staying here in this motel, I think I have a right to know with my kids, if I'm living next door to somebody. Yeah, because I think the anticipation is you're living next door to other tourists. Most people feel that way. So we started this a couple years ago and it kind of didn't go nowhere. So we're rebooting it. Appreciate Malia's help, Andy Phillips' help. I don't know really what committee it's going to end up in, but we're asking that this be on people's work plans and that we figure out a way to do it. And that's all it's really about, is just hoping we can have a licensing process and a permitting process. If you want to operate that kind of business here, that there's a process. Then it's kind of like one of these things right now. It's like everyone knows what's going on, but no one wants to talk about it. And I just think that's not good policy. So that's my support and my push for this. And I just hope that it stays on committees.
And I think that's why it's good to have Andy Phillips take part in this, because the question is, we could arguably, if we found the right authority, do something with zoning, but that would only address the outside of the municipalities and only in those townships that opted into county zoning. So we're looking for something outside of zoning to address it, probably more in the licensing and the health side, and safety and public safety. So that's where we are. I'll give you updates as soon as we touch base with Andy on what he finds and his team. But I think having the WCA say, hey, we're going to look into this for you on our dime, that's a positive thing. So maybe we can get some input from other counties as well.
Leah, are there, 72 counties in the state, are there other rural counties that have those types of ordinances in place already?
Not that we can find in currently. There's nobody addressing the issue, but there's also never been that ask. So other counties have nuisance ordinances,
Okay.
certainly, but not addressing this particular nuanced issue.
Municipalities have a lot of the big cities have it.
Right.
Not counties.
Not a countywide.
And do we know, this could be just something to put for the future, but like the people that we're talking about, are we, you kept referencing sex offenders, but I mean, those are sort of licensed people that get placed in certain places, but maybe we can have a better understanding of how many of those are maybe being housed in places that are what we're talking about.
Sure. So sex offenders, we can know. I mean, there's a registry, you can look on a map, you can know exactly where they are. But the Department of Corrections, there's a lot of very intense rules regarding the requirement of housing those sex offenders, and that's in Chapter 980. But there's also the other transitional, people leaving prison that don't yet have a job. I mean, they get a social worker, they get a probation officer.
Transitional piece that we're talking about.
That transitional
Okay.
piece. How long are they staying? How much do they, there are houses where they're placed as well, outside of motels where people who own property can rent to the Department of Corrections, because they make a lot more renting to the Department of Corrections generally than they can get on the regular market.
My comment to that too is that, yeah, you could put a registry out that at a hotel or motel that there's a sex offender living in there, but it's not posted on the desk.
Right, unless somebody volitionally goes in and looks
And
at,
looks for that before they go rent. I'm tired. I'm gonna pull into this motel. There's no sign when you go up to pay your bill that, hey, you're living next to a sex offender. It was only notified the day that person was put in that facility. So I think there's some signage issues that'll develop out of this, some notification issues.
there is some federal case law that limits our ability to go, hey,
Discriminate.
so that's why I'm glad that we've got Andy Phillips. Okay, thank you.
Thanks, Joe.
Yeah.
Go up.
Yes.
Your glasses.
Oh, you can actually just throw them down here when you're done. They're not really gonna cost you $500, Joe.
I know.
You can keep it. Yeah, let them.
Give me a buck.
That's more than he paid for.
Okay, moving on.
Great.
Drug enhanced children presentation, Sheriff Watt.
Yes, okay, so we, when was that, Lee, that you guys went to that? August, a couple months ago. In August, 6 months ago. It feels like yesterday. We sent a bunch of people down to attend the National Drug Endangered Children's Conference. And been meaning to get the group here to talk about what that means in Polk County and what they've done with what they learned down in Nashville they got to go to. So we asked Malia and Lee and Sheriff Walk, and I don't know if DA Kemp is able to. I don't think he's gonna make it. Okay. He's got some personal stuff going on. Yeah, okay, so otherwise, we've got our top people who are the coordinators of drug endangered children's efforts here in Polk County. We'll have them present to you on what it means, what we're doing, and how we are working with those kiddos in Polk County. And this is sharing, right? So anybody who's on can see it. Right, okay. All right, so you guys know who I am, right? And this is Lee Wallen. If you haven't had the pleasure of meeting her,
What is your official title, the manager of?
I am the Director of Department of Children and Families. So that houses youth justice, child protection, foster care, and our family support.
And then obviously, you know, Sheriff Walk, and we are so grateful that this particular sheriff has decided to support and revamp and re-energize our DEC program here. DEC stands for Drug Endangered Children. It's a national organization, national DEC. State of Wisconsin has a state of Wisconsin DEC team, and then we have our local Polk County DEC team. And we took the lead on saying, hey, this is a really good program. We went to the training, we went to the conference, which was extraordinary, but Nashville is a ridiculously expensive town. So I don't know if I'll ever go back there because that cost a lot of money. But anyway, we're grateful that we were able to go. We encourage our local law enforcement agencies and the municipalities to go. I think we had one. Yes, yeah, one
Clear
go.
Lake.
Yeah, and several of my staff have attended the conferences in the past. We opted out of the Nashville because of some of the cost. And we had also attended a big conference in Phoenix earlier in the year. So our intent is to continue to do the trainings and people kind of come back really energized from going to it. But give a little history. So DEC was really active probably 10 years ago in the county. It was really taking off. And then for various reasons of some of the personnel leaving that were heavily involved, it kind of started falling off the radar. So with the help of Lee and Malia and myself, we kind of got it kicked off again. And I would say we've had really good buy-in from the municipalities, the local police departments as well. And one of the areas I think we really dropped the ball in the past was traffic stops. We never thought the DEC process on a traffic stop. So if we stopped a car and they had drugs in the car, we just didn't even, pay that much attention to the children. And the same within search warrants. 20 years ago, the goal was to find contraband in a search warrant, not necessarily look after the welfare of the kids. It was we got in, we found our drugs. Oftentimes we wouldn't arrest parents. We would have them summoned so that we had someone to watch the kids. And now actually working with Lee and through corporate counsel, we always get caseworker there. We always try to remove the children from that environment. And I think it's gone really, really well.
Yeah, I would agree. And that's what it's really about is collaboration. So when we're talking about drug endangered children, we're talking about any kiddo that is in danger because their parent or caregiver is using drugs, under the influence of drugs, selling drugs, making drugs, or at all involved in illicit drug use or prescription drugs or alcohol. Because children who are endangered because their caregivers have issues with drugs, 3 times more likely to be physically or sexually assaulted, 4 times more likely to be neglected. And we all know in Polk County, the 2 biggest things are methamphetamine and alcohol when we're talking about drug endangered homes. When children grow up in a drug endangered home, they're more likely to have substance abuse issues when they grow up. This is something we know and we have evidence for. Bottom line with DEC, when you have kids and you have drugs, those kids are at risk. And how can we take all of our silos down and work together in order to address the issue? Now, these photographs here are not from Wisconsin, but let me tell you, we have a lot of photographs that would break your heart. But we are a small community, so I'm not putting up pictures here of anything local. If you can see here, this little kiddo is in a playpen with a door over the top and stuff placed on top so that they wouldn't bother mom and dad who are making rock cocaine in the other room. You've got this other little 4-year-old boy all alone, scared, law enforcement's walking in. When you're talking about why we care, why is it important to address it? And I'm preaching to the choir here, I know this. But they're gonna have behavioral issues. They're gonna have emotional issues. They're gonna have cognitive and learning issues. So we need to intervene. This is a case that will break your heart. A little girl on her 10th birthday told the school resource officer, hey, there's drugs in my home. So they went and arrested daddy. It's really hard.
And we actually, at the National Deck Conference, we were able to, I sat on, I think you sat on that panel too, where they were now adults, but it was a panel of 6 young adults that were drug endangered children when they were as little as 4 or 5 up to teenagers. And it was so eye-opening because they were able to talk to us about what that felt like when police came, what that felt like when the CPS social workers came in that intervention. And a lot of times they said, I knew that nothing was going to happen that day, but I knew that they were going to be nice to me. The one kid said, I loved it when the officers showed up because they always brought me a cheeseburger. And then like when we were asking specifically, like, how can we do a better job when we're coming into your homes? Because you lived that experience, right? You went through that trauma. What does that look like? And how can I as a social worker do better? My team do better? And it was simple. I mean, it wasn't anything. It was like, be nice. Like the one girl's like, I just really needed a hug. I mean, their world is collapsing around them, right? And so it was just those really trauma-informed practices and those DEC practices that we're talking about when we're meeting every other month, and we continue to have trainings for our staff. I mean, it's like Melanie said, it's not rocket science, right? It's just being really trauma responsive to the families that we're in and just understand that their world is collapsing right now.
A big part of how we handle a debt case, what's changed, and this is a quote actually from one of my investigators who's pretty seasoned. He says, oftentimes these are a quality of life search warrant. We're improving the quality of life in these houses by taking the children away from them. And when we go in and we find the drugs, now we measure how high off the ground it is, and can these children accept, get access to that? And that's important for the court case.
Right, because then the DA can charge neglect or endangerment. And we'll have in our office the child welfare case placing the kids out of home. And then one of the ADAs will call me and say, how is this mother doing? Is she complying with your court order? Because if she is, then I'm going to do a deferred. In other words, not prosecute her right now, or I'm going to, have some other lenient argument for sentencing. So we're working together so that if the parents are doing what they need to do to get their kids back, that has a benefit to them in the criminal justice court.
And we really see it as a positive that we may not have found a mother load of drugs, but we found enough to get the DEC process going and improve the quality of life in all these homes that we go into. And a photograph doesn't capture what the smell in these houses are either. I've tried to preach that. If you saw some of the conditions these people expose children to, it's horrifying. So we're happy to get this process up and going. And I think we've always done well in the past of recognizing some of the problems, but how we process a scene now has changed. And our mindset just going to the scene has changed too. It isn't always just about that mother load. It's about making it better for these people and these kids.
And now we've been joined by DA Kemp, and I was just explaining, Jeff, that one of the things about DEC is that if I have a case where the kids are placed out of home and you guys have a case where the mom is being prosecuted for child neglect or endangerment, then we'll have a conversation, your office, my office. Hey, how is mom doing? And if mom is doing well, that'll affect how you handle the criminal case. And all of this is breaking down those silos, because the whole idea of a DEC team is interdisciplinary, getting people from different areas. We have law enforcement, we have social workers, we've got Jeff's office and my office, so we've got the court system. Now we need the schools, we need the medical facilities, we need the social workers that are not county social workers. But that's the whole idea of DEC, again, is everybody, all of these people from different facets of life who have different interests, maybe at the beginning, joining together and saying, what do we all care about? These kiddos, what can we all do working together and sharing information?
It does. It helps my office as well, because we have more information. You can never have too much information. We're supposed to be like sort of trying to incentivize these people to change their lives, and we're sort of the teeth in it. And if we don't have information from CPS about what these people, how this is actually going on, like during the case, before I make an offer, I would have to have just a defense attorney. And sometimes they're not, they don't really tell the truth. That's maybe a little harsh, but they try to make their client look better. But at least this way, when we're talking with other agencies, whether it's law enforcement or CPS, we get a clear picture of what's actually really happening.
Right, so the defense attorney might say, well, they haven't been positive in any urine drug screens in the last 6 months. And he calls our office and we say, yeah, that's because they haven't been coming in for their urine drug screens. So it's all about the context and the way the information is shared.
Yeah, the information that we're sharing is, are they coming in for their drug screens and what are the results of those? Whether they're at the county or when the worker goes out to the home. Also, we're sharing information about, are they participating in their AODA treatment, whether that's outpatient, inpatient, mental health treatment, or other services that we have requested and referred them to.
Before DEC, there was a time when we reunited a parent with their children, and a week later, that same parent was charged with child neglect because a different administration had waited a year and a half to charge out that child neglect case. And we're like, no, you can't take her to jail now. She just got her kids back. She's finally clean. And so that we just didn't have those conversations. We can skip over some of these because again, I'm preaching to the choir.
I think the collaboration is key. I think what was 2 meetings ago where we talked about a specific case and it was in a different municipality, but there happened to be another municipality here hearing that information, sharing that information, just about some updates on that case. And it was 2 days later, I think there was a traffic stop or an incident happening. And had that police officer not been to this DEC meeting and heard those updates from that worker, then that could have played out very differently. But the DEC process was followed, the child was removed, the police officer sat with him, and he actually said, I wouldn't have known that that child was at risk, that was a drug endangered child, had I not participated in heard this information. So it's out there, and I think it's working, the collaboration.
And it has been hard to get law enforcement to see the world the same way as a social worker. Because I don't know if you know this, but law enforcement are a certain personality type. Social workers are a slightly different personality type. And it used to be there was a lot of conflict, not necessarily in Polk County, but across the nation. And this national DEC program and their trainings brings these big, tough guy, sheriffs from all over the country coming in and go, yeah, I thought this whole DEC thing was stupid until I sat down and heard these stories. And I went back and I became a champion of DEC. And that's why these trainings and these meetings are so important, because it really does open your eyes and shift perspective.
And I think what we're also doing in our DEC meetings, Sheriff Walk had a great idea, to have some presentation, some education, right? So at our next DEC meeting, the Sheriff's Office is going to talk to us about that search warrant process, right? Because I'm a social worker, I just think you just go ask for a judge and you get one, and that's that. So, we're going to learn about that search warrant process and what that takes and what that looks like in their office. And then at another meeting that, child protection, we're going to talk about that screening process, right? Like we get a call and what that process looks like. Do we screen it in? Do we screen it out? And then how soon do we intervene? Is that same day, 24 hours? So we're also educating each other's offices and the other service providers in the county just about what our role is, what we can do and what we can't.
Well, and then there are those bridges that are built. So the officer that is going out on the search warrant has the cell phone number for the social worker that's on that day. And then the next time something comes up, if they don't know who to call, they're going to call that social worker, or the social worker, when they run into a situation, needs an officer. Those relationships are created. And that level of trust that, hey, when law enforcement calls, the social worker is going to come out. And when social worker calls, law enforcement is going to go with them. We want our kids to be safe. We want our children to be not at risk because of drugs. And that's why it's important to have and support the local DEC team, because kids deserve that. Like the elderly, like the mentally ill, like the cognitively delayed, children by their nature cannot protect themselves. And that's why we as a team, as a multidisciplinary team, are working together and making them a priority.
And the risk continues to grow because now we see the fentanyl threat in a lot of these drugs. And so we can see where countertops, we swab a countertop and it tests positive for meth. Well, if a child can touch that, when there's fentanyl, that's an instant overdose situation. So the risk is getting greater and greater every day with what we see in our communities.
Yeah, we're doing hair follicle testing on kids. On babies and kids all the way up to 18, and their hair follicle testing, they're coming back with high amounts of meth, amphetamines, cocaine, heroin.
And it used to be that with the DA's office, they would want a positive hair follicle on a kiddo before they would charge out a child neglect. But now, because law enforcement is doing such a good job of measuring, and in their police report saying, yeah, this methamphetamine was located in a place that was accessible to the children. or was kept close to the bottles where the baby was fed. I mean, those things that normally historically wouldn't find their way to a police report are now right on law enforcement's mind. So it makes it clear, it makes it a lot easier for the DA's office to look at that and go, well, that's clearly neglect and charge it out, where before they needed more.
Yeah, the devil's in the details.
Mhm.
You know, if you can articulate why this child is in danger, you know, from the get-go, we don't need to wait for it.
Thank you. Anything else you guys want to add?
Did you mention the school?
No, that's going to be.
Yeah, so I just, for deck moving forward, how we have it set up in Polk County is we meet every other month over at the Sheriff's Department. Like I said, we do case updates, share information on case specifics. We give up unit updates, and then we are now doing some education piece, like on search warrants and on CPS process. We have someone from Hazelton coming to talk. And in July, it's still in the works, but we're planning a core deck awareness training for all the law enforcement and child welfare staff in Polk County. It's been over 5 years since Polk County has had this training, and there's been a lot new staff and new people on the team. So we thought we're going to bring it back, get everyone trained, and review our MOU, deck protocol, things like that. And the trainers come from Buffalo, so there's a sheriff that's coming up to train, and then the director of human services. We're planning that, and then Handle with Care is an initiative that came out of DEC. What Handle with Care is if the police officers are at a house, whether it's on a search warrant or they're serving a warrant or they're there for a domestic call, whatever that call is, they notify the school the next day. It's very simple. They just have a sheet of paper with the child's name, date of birth, or what grade they're in, and all it says is Handle with Care. What that really is that's a trauma responsive protocol, right? They're not giving case specifics or what happened to that child. They're just notifying the school. Little Johnny comes in tomorrow and you see something different in his eyes or his behaviors, handle with care. Something happened, right? I mean, they don't know what happened. They don't need to know. They're not, I mean, part of that training is not asking the child about that, but that may include like the child goes to the office and sits with a mentor or goes to the guidance counselor a little longer, or they get longer time to take a test that day, right? Because if you could imagine being a 6-year-old child, having the police come in, maybe serve your parent or take someone to jail, or there was a fight in the house and the police were called. Those are very traumatic events for little kids. And then we expect them to go to school the next day, right? Sit in their desk, take a test, write a paper, whatever that might be. And so this is just a way of saying, handle with care today for this kiddo. Again, with no specifics. So for Polk County, we've started it in Unity School and St. Croix Falls School.
Well, the city police is doing it for St. Croix, but got started as a pilot program with Unity School. And I think the goal is to get it to all schools eventually here in Polk County.
Yeah.
So I'm just curious what the kind of bottom, I get the concept of endangered kid in a really bad house, but what is like the minimum trigger which triggers an endangered child action on all your parts?
Well, it doesn't necessarily mean removal from the home. You know, it could be an offer of service. I mean, you could meet a parent and this is their bottom and they're like, yes, I need the help. And, you know, then voluntary services can be offered. But with law enforcement, you know, law enforcement going in and maybe when they're talking to the mom, they could say something like, hey, you know, this might be your opportunity to get help. And, you know, when you have a child removed or are at risk of losing a child, that might be your strongest motivating time to try to do something. Because one thing about methamphetamine, it takes over your brain. It becomes the most important thing in your life.
With the typical meth issue we see, there's not a gray area. It is so obvious that this is a trauma situation. That it's you know, when we find that meth and there's kids in the house, it is such a disaster that it's just a no-brainer for us to know. I think where we've expanded now, I think where we used to miss some of the opportunity to get DEC involved and get this process going was the traffic stop area. In fact, 2 weeks ago, we just had, I think it was a 4-year-old who was within arm's reach of an ounce of meth in the car. And we got the process going and social workers came out and handled that situation. And I think in the past, we didn't look at it that way. You know, we would, you know, we made an arrest, we found an aunt or an uncle or someone to come get the kid off. We went and it just kind of slipped by. So I think that's an area we've really improved.
And it doesn't always have to be meth, right? I mean, I think of a case about 4 to 6 weeks ago where there was a lot of marijuana use and there was pipes and there was gummies all within the child's reach. And so that became a debt case, right? So we went in and talked to those parents, provided services.
Do we have alcohol-related debt cases? How does that, I'm sure we must.
Absolutely. I mean, we had a couple of really heartbreaking ones. And, you know, if I look at one from several years ago, we had one where there was, you know, pimping out of a child. And that was all related to alcohol. So it's anytime, and it can be prescription drugs as well. And even sometimes used in the amounts prescribed because they've been able to doctor shop and maybe have several prescriptions. So, you know, DEC isn't just talking about meth, but obviously meth is I think, the number one driver of removal from the home in Polk County. The number one out of almost everything else combined.
And you would think the presence of a SWAT team approaching a house would have a really, like the kids would be completely just in fear. They are exposed to so much dysfunction in these houses that they don't even have an adverse reaction to our SWAT team rolling in. It's just another day of chaos in their life.
They've learned to tune out the trauma because it's a trauma response.
Yeah, and it always amazes me when I would take kids and I'd be like, all right, you know, we're gonna go see my friend. And they're like, okay, let's go. I'll get a bag. I mean, they just, you know, there's no like, I don't know you. You're not safe. They don't look, you know, they don't look to those parents in the home to, is this a safe person for me to go to? Because I think they're used to just, you said, chaos and not having that consistency.
Well, I just want to follow up on a comment that you made, which I think is really important. This kind of fits in very well. Next week at the CJCC meeting, we will have a presentation on what the schools are doing in the county for mental health. And we've surveyed the 8 schools to see the programs that they're using. And again, Unity kind of being the model for that with the trauma-based education that they're doing. We'll put together, or we have put together a presentation, and we'll do that next week, just so you can see what that trauma-based stuff is for schools. Real interesting, you know, the sheet that you use, you know, again, having counselors be aware of that, staff being aware of that. There's a quick follow-up in these schools to kids who are trauma-based, and having a SWAT team come is trauma-based. May not think of that, but it really is. So you'll get more info next.
Sounds great. Thank you.
Some of the people know, but others don't, that we have full custody of our grandkids. And just this morning, well, we raised them pretty much their whole lives, but this morning, a 15-year-old girl told a 8-year-old boy, start doing stuff yourself, get dressed yourself. She says, I've dressed you for 2.5 years because mom and dad were in bed and they were out of it. And they did have, the kids both had to take hair follicles because they were around it. And so it's a struggle. And then, of course, the parents, they continue to say, I want them for the weekend. Oh, you can't have it. Then it's hard for us because it's my daughter, you know. But you got to stand up and do it.
Yeah, drug use just doesn't affect those parents and kids, right? It expands out to family members, to community, to friends. It's very heartbreaking. And it's trauma. And what we know about trauma is trauma affects the whole body, right?
Yeah.
Physical part, your emotional part, brain. I mean, it's all connected.
Well, thank you so much for your time today. It was a
Thank
pleasure.
you.
Thank you for your work.
Very good presentation. Okay, moving on. Number 9 is medical examiner virtual autopsy.
Okay, so we have asked our medical examiner, John Denny's, and St. Croix County Medical Examiner, Patty Schachter, to come in and talk about a new exciting initiative in their world, virtual autopsy. So Patty will get to talk about that. John, you can kind of set the stage.
Thanks,
You guys
Well,
had exciting
I tell you,
lives.
that was a wonderful presentation. And just when you think it can't get any darker than that, I come in and talk. Unfortunately, I also will be dealing with these similar situations. Mine's always in a much more dramatic and a much more generally sad situation. But that is something I would like to get involved in. That program, I think medical examiner working with this would be helpful and very interesting. Before I introduce Patty, I just want to give you a brief summary of how the year 2021 went in the medical examiner's office. And previously in 2019 and 2020, those were our record number of years. They were the busiest on record for the medical examiner's office. And in both of those 2 years, we handled 421 calls for service. Every year has pretty much just been continually going up in the medical examiner's office. Unfortunately, in 2021, so I'm sorry, it's 2019 and 2020, we had 421 cases. In 2021, we handled a new record cases, 510 cases. That's unheard of in our office. We've never, ever handled that many cases in 1 year. In this year, we had 12 cases that required an autopsy. 478 were considered natural. Many of these, I can't say, I shouldn't say many, but this year we actually, because of COVID, was one of the bigger impetuses behind the increased number of cases that we handled. I tried very hard as a medical examiner to review each case that was deemed COVID related, wanting to make sure that, yes, it is a true COVID death and not, so I can dispel any concerns that people have about people just adding COVID to whatever the cause of death was. That was very important to me to make sure that we adequately and accurately talked about that. We had 22 deaths that were accidental, 1 homicide case, and 6 suicides. Suicides were 5 gunshot wounds. All were men between the ages of 16 and 76 years of age. And then there was 1 suicide, male, related to hanging. Certainly far and above the most frequent cause, or the most frequent call for services, a request for a mortuary for a cremation permit. I've talked to you guys before about this, how cremations are continuing to be the primary route of final disposition instead of typical funeral, casket funeral, viewing, burial. Almost now, I think in Polk County, we're up to well over 60 to 65% of all cases will be cremation. In the state of Wisconsin now, the county coroner or medical examiner must sign a cremation permit for that funeral home. Signing of a cremation permit in and of itself is a very simple procedure. However, the state law requires that we actually view the body, go to the mortuary, view the body, ensuring that there's no obvious trauma, there's no obvious injuries or anything else, and making sure that we have the right individual. We then need to obtain medical records, review the medical records, and make sure a number of things. We have to assure that if I'm signing the cremation permit, that death actually happened in Polk County. Many times, somebody will live in Burnett County. They will fall in Burnett County, break a hip, get transferred down to St. Croix Regional Medical Center where they have their surgery. Then they get transferred to the United Pioneer Home in Luck, for an example, but then they die. So all of a sudden I'm getting called, and yet according to the law, that case needs to be referred to the Burnett County Medical Examiner. So it's those little technical issues that do tend to cause some issues along the line. Far and above, though, that would be our most common call for service, would be more of a cremation permit. The medical examiner's office has been part of the Community Services Division 3-4 years now. I think something like that, or about 3 years.
Since 2015.
Since 2015. And I think really this has been, prior to that, I was over in the law enforcement center. But I think this has been a very good move. As so many of our cases involve public health issues, obesity, smoking, alcoholism, you name it. These are all risk factors for death, and they're all public health issues that if I can give our public health folks more information on what is going on from my standpoint, potentially the hope is that, well, maybe we can work on ways to prevent some of this stuff. And that's kind of the one of the main roles I see myself playing as the medical examiner for Polk County. So I'm giving you just a brief, short synopsis of my office for this last year. But what we're really here for today is I want to introduce Patty Shackner to you. Patty is the Chief Medical Examiner for St. Croix County. Patty and I have worked together for many, many years, collaborated on multiple cases. And this has been a very exciting new venture that Patty has gotten into, and I've been thrilled to be part of it. Recognizing that autopsies are, number one, are very expensive for us because we as a county pay for somebody. Anytime I order an autopsy, we as a county are now obligated to pay for that. So I take my responsibility very seriously as far as how I'm spending the county's money. And yet you don't always want to make a decision one way or the other based on money, on whether or not an autopsy should be done. Many times families don't want autopsies. They understand what happens in an autopsy, and it's very distasteful to them knowing that their loved one's going to be going through an autopsy. So what Patty's going to be talking about are virtual autopsies. And we've all heard of virtual these last couple of years. Good God, has become part of our everyday language. But this is more of the use of CT scanning. So many of you, I'm sure, have gone to the hospital and had a CT scan for one reason or another. Well, now as the years have progressed, they found out how could we as a medical examiner use a CT scanner to maybe look inside the body like the doctors do to find a cause of death. Very interesting concept. And I'm going to leave the rest for Patty to talk about, but she has a wonderful presentation. Patty, thank you very much for coming up today. We appreciate it very much.
Thanks, John. Is it labeled Polk County? Yeah. I just want to make sure I open the right thing. There's no pictures, don't worry.
I'm waiting for them.
Well, thank you, John, and thank you for having me here today. I am super excited. I have been so stoked about digital autopsies. I first talked to John about this topic about 10 years ago and knew that based on what was going on and what we were seeing and the cost that we were spending on autopsies and looking at the demographics of our population, that this was only going to go up. So we're both collaborating together, and I think it's really important when you're collaborating to always collaborate with someone who's smarter than you. So I picked John. He's way smarter than me. So, that's a sign of leadership, is making sure that you get someone who's smarter than you. When you talk about death scenes and death trends, we see everything before everyone else sees it. I was just talking to John about a trend we're seeing in St. Croix County, where we're seeing this. I contacted public health yesterday. Just like that, they contacted the CDC, and it's like, yep, turns out that this trend is true. And that, so now we have a new thing to start monitoring. And the fact that we're seeing it already is important. So when you look at how our counties are, they're really not that different except for population. When John talked about his calls in the year, this is ours. Starting in 2017, we had a little under 600, 2017, 18, 19, pretty much the same. 2020 came and we jumped up to about 800. Last year, we were over 850 and projecting what we have already this year, we're going to be at 1,000 cases this year in St. Croix County. And that number is not going to go down. Next slide. So if you compare that to the actual population comparisons and population density of our communities, you can see just based on our age, like I always say, no one's going to win this race. They're all ending up in John's office, and here in Polk County, you have 21.3% of your population is over the age of 65 today. Next slide. So keep that in mind. So then when you look at unnatural deaths, that's our biggest work, is really looking at unnatural, unexpected deaths. Those ones that die at home, car accidents, suicide. In St. Croix County, we keep track of a lot of our data. And, basically when it comes to lethality in criminal cases, we're a very safe county. If you look at suicides, our numbers have been pretty stable. We're under the national trend, which is where we want to be. Every suicide is one suicide too many, but we are working really hard to make sure that we keep those numbers low. Accidents, if you look at that just keeps going up. And there's been a switch in our accidents. If you look at the deaths that are ruled accidental, you will see that we have switched from accidental drug overdoses and car accidents to falls of senior citizens. The falls of senior citizens are impacting our work right now, and that is going to continue to happen, and especially those lethal falls. And then you have falls that are related to alcohol and drugs. So these are all things that are coming. And then you always have that hinky, undetermined place where we really can't, through our investigation, determine what the intent was. Was it a suicide? Was it an accident? We can't really tell. So those cases are left open. And for law enforcement, that's kind of a nightmare, because that means that's an open case for them. And that it's an open case for us, but there's always something that could come back. So if you go think about population, right now in this country, 10,000 people a day turn 65. And that is going to continue every day until 2030. What does that mean? That's going to cost us in chronic diseases. It's going to cost us in our services. It's going to cost us in everything. So while we're swaying back and forth in addiction and mental health and all this here stuff, there's a whole population that is going to depend on the services of what we do, our work. And it is the aging population. And when you look at that, by 2030, 20% of the population of this country will be over the age of 65. That is huge, and that is what we have to start thinking about now. Now, John and I, we're real nerds. We knew this, but no one listens to us. And we were telling everybody this aging population, of which we are part of, this is where the big problems are going to come. And when you think about it, just think about it in perspective. By 2045, there is projected to be over 1 million people that are centenarians or older. I mean, that's awesome. I hope I'm one of them. I really do. In that. So longevity and planning is on our side, but there's things we need to do. So next slide. So when we think about it, we have to think about what are the services that we have already. There's going to be an increased need for hospice. We know that. When I started doing this work, we had 1 hospice agency. We now have 11 hospice agencies in St. Croix County, and I would guess that you guys have 7. Yeah, and these hospice agencies, they are serving both the Wisconsin side and the Minnesota side. And when it comes to hospice, I mean, it's really fluid and it's changing all the time, and people are coming in. And that's one thing that John didn't say is us, Polk County, St. Croix County, Pierce County, and Barron County. Years ago, we simplified the hospice program by having a uniform registration. So we know we have a really good system set up with our hospice agencies. However, capacity is the problem. Capacity on a daily basis. I can have 3 registrations going in and 2 going out the same day, and I can have people that were attempting to register for hospice that died without hospice that now becomes a scene visit. It's really complicated. And then there's also remote care. there is a lot of our elderly right now. The only care they get is remote care, telehealth or online, or just doing their own research. Community paramedics is something that is probably going to be our future, which is we are going to work with. And then at-home hospital care with technology is going to increase the work we do, because they're probably not going to sign up for a lot of the hospice and long-term care services. So these are all things that are going to increase the work of the medical examiner's office. Again, remembering when you look at your population data and how your population and your density, how far apart our people are. You know, John could be doing a case in Osceola and have something going on in the very other side of the county, car accident over there, and we only have one person on call. That's how busy our work is. And then there's also the at-home testing. People are testing at home for everything and self-diagnosing and not getting medical care. So when we go to the scene, they'll tell us what they have, but they haven't been to the doctor in 23 years. Well, how do you know that? Well, I did this test. So that makes our job much more complicated. Next slide, please. So when we start thinking about that, we go into the exact same conversation that we had earlier with drug and endangered children, is the health disparities that we're seeing in our communities with poverty and longevity, and the fact that some are so rural, food deserts, lack of transportation, and workforce. What this looks like from us in the medical examiner's office is that married couple that were married for 60 years, the primary caretaker died, they buried their only child, and they're living at home by themselves. They have literally no food, they have no access to transportation. They're literally in a hoarding house all by themselves. We see this, law enforcement sees this, we see this more now than we've ever seen before. And our folks, especially our senior citizens that are living in very rural areas that have no people. And it's hard to believe that we can live in a part of Wisconsin where you literally have no people. You have no one to count on. These are the cases that we're seeing more and more of, and these are the cases that when we look at health disparities, we need to figure out how to get them into our services before they become that person that's isolated. So as we're watching for the trends of the future, telehealth is big, social determinants of health, and addressing the social determinants of health. Next slide. So this is kind of an infographic that everybody should really get familiar with, because this is going to impact our communities for the next 40 years at least. And it's really looking at this and then taking it and putting it in your each, collectively, a whole family of multi-generational folks can take this whole thing. But, just senior citizens can also go into this. So knowing the social determinants of health of our communities is really important. John and I, when we do our year-end statistics, these are things that we're looking for. What was the education rate? I mean, I have an intern right now that's going through all my death certificates from last year. That's going to break down every single community in the county of where people died at home by themselves, and what were their social determinants of health, and then how can we address this in the future. Next slide, please. One more. Cremation. John said it, and the cremation rate is what really guides us. Next slide, please. So for us in Wisconsin, we have 48 hours that we have to get all our pertinent information ahead of time. And when and after 48 hours, cremation permit can be signed. It's, homicides, we can literally put a hold on a body for a year for a homicide. Suicides, we have to make sure we have all the information correct when we sign that. Whoops, it must be a touch screen. Accidents and undetermined and natural, these are all things that when it comes to death, that manner of death is so important. And when it comes to cremation and trauma and all this other stuff that goes on, we have to do it effectively and efficiently as and as professionally and accurately as we can in a good amount of time. Next slide. So what does that mean? Because of this cremation rate increasing, when it's gone, it's gone. So we have to be able to do things now. Next slide. So we're in St. Croix County. The conversation about 10 years ago was LODOX. LODOX was a 1D, one slide digital autopsy. The cost of that piece of equipment was $1 million or $500,000 plus by the time you got your building up and running. It was out of our hand. But I kept talking to the board and telling them why this was important. Number one, in order for our forensic labs to have accreditation, they can only do so many autopsies a year. You heard John talk about all the natural deaths that he sent for autopsy. I too send natural deaths. I mean, we like to think we're superheroes, but we don't have X-ray vision. We have to have that real autopsy to get done. But if we had X-ray vision, we would be able to cut the cost to our counties by doing digital autopsies. So that was 10 years ago. Last summer, I went to the International Coroner and Medical Examiners Conference, and there was this new technology. I was already on the KIP. We were going to get our LODOX next year. And the new technology is CAT scan machines, 16 slide medical grade 3D, become obsolete. It's like lots of different technology. When they become obsolete after a certain amount of scans on live human beings, they can't go anywhere. This company purchased a whole slew of these CAT scan machines, revamped all of them. And St. Croix County purchased this one for $198,000. We now are on the next phase. We put our room out for bids. We now are turning St. Croix, our building, into the starting of a regional forensic center, starting with our CAT scan machine. John, his brains, remember, you got to hang out with the smart guy. He is going to be able, with his brains and knowledge as being a physician's assistant, is going to guide us through this process. And because he's helping guide us through this process, we are going to actually partner and collaborate so that Polk County can actually lower their cost of autopsies, because we're doing this together. And so collectively, we should be able to save the county tens of thousands of dollars to be able to do digital CAT scans. This is a 16 slide 3D CAT scan, which is just, I mean, we're so excited we can hardly stand it. I literally want to go through it myself just to see what it looks like. I really do in that. But this is going to change. We're going to be able to rule out trauma right at the time of the incident. What that means to the other people and services is law enforcement is not going to have to sit on a scene waiting to rule out trauma until the autopsy, which is the next day. This is huge. This is going to save all of us time, energy, and money. Next slide. So it's less evasive. We'll be able to, the biggest thing that people want is number one, they watch TV, so they think that we're going to give them an answer right now in that. But our job is to rule out trauma. If, someone is, because it goes back to manner. Was it an accident? Was it natural? Was it a homicide? Was it suicide? Or is it undetermined? If we can get a visual right away and rule out trauma, then we know we can go down the route of medical records and toxicology. And we have the capacity now to do this on their own. We'll be freeing up resources. It's less evasive. People don't want to know that their loved ones have been dissected. They don't want that unless it's necessary, and it's not always necessary. We'll have a collaborative partnership with public health, our healthcare systems, and Polk County, and we are super stoked about it. Next slide. So we are doing everything we can to not only bring 21st century forensics to this region and be leaders in the area, but we're also doing what we can to do our part to make sure that we're fiscally responsible to people, committees, and the population that we serve. So our project went out to bids last week. We do our final walkthrough on next Thursday. We will be doing our build out in the 2 months after that. We will be up and running by August. We have a whole wing of a building. We're bringing in 2 walk-in coolers that will hold 24 people is our goal. We are preparing for regionalization, and we are already getting calls from the southern part of the state wanting to know how these 2 little counties, Polk County and St. Croix County, number 1, got this idea, number 2, secured the idea, and number 3, implemented the idea, because we also in our building have the potential to have our own autopsy suite. So having this done, we can actually recruit a forensic pathologist to come here and work for us. And to know how important that is, there are only 450 certified forensic pathologists in the United States. To hire a forensic pathologist at a county level is a $1 million acquisition. So to have this here starting, and we're doing it here in regionalization in the area that we serve, we feel that between our collaboration that we have set up St. Croix County and Polk County to be the leaders in forensics in this area. Anybody have any questions?
I just want to, if I could, Patty, just put a couple things in perspective. As I said, last year, we did 12 autopsies. Most years were generally in the 18 to 22. Each autopsy is a minimum of $2,000. That is the absolute lowest. On top of that, we have to pay a mortician to literally drive the patient down to the mortuary and bring them back. So when all said and done, it's $2,500 minimum to do this. As Patty was saying, there are not many forensic pathologists in the United States. We're fortunate that Minnesota probably has 6, maybe 7, 8, depending upon if you count the residents in Hennepin County. They are overwhelmed at this point with their work. They have standards they have to follow that allow them only to do themselves so many autopsies per year. They cannot do any more or their potential to lose their accreditation. And the reason behind that makes sense. If you're doing more than you physically should be, you're going to make mistakes and you're not going to be as professional. So they don't really like it when we send cases down to them because they're already overwhelmed. I need to know at least some information. This option is going to be a wonderful option for us. I think of, I mean, I can just sit in my mind and think of the cases that we could use. A car accident, for instance. Many times we'll autopsy a car accident because there's law enforcement involved and the drunk driver on the other side is going to be charged. And I need to give the DA as much information as I possibly can. With a CAT scanner like this, I will be able to list every single injury that that person has. And I will be able to take toxicology myself. So literally, we're hoping to be able to give the DA all the information he needs for a prosecution and never have to be invasive to the patient and never have to tell their family that we had to cut them open, take out their organs and put them back in.
And if I can reiterate, one of the options with this CAT scan machine is that we have already contracted with a forensic radiologist that will read and give an official report. So we still will get that official report that forensic pathologist gives. It will be done with a forensic radiologist. So
it will not be us actually giving the interpretation.
We're not that
it's going to be a forensic pathologist that we'll be able to give to Jeff. I can think of numerous cases, where I know in my heart, I don't need an autopsy, but the family is pushing us for this. And make no mistake, there's nothing more uncomfortable in my life than to have a family mad at me and upset that I won't do an autopsy. Well, I don't need, this is my phenomenal option to be able to offer to them. And this should be able to handle, I would think 80%. I would think 80% of our autopsies could potentially be done through this. Now, homicides are not going to be, SIDS deaths are never going to be CAT scanned. And there will be certain ones, of course, that we just need.
And the other option is they will all be scanned in a sealed body bag with law enforcement there. So even if law enforcement has a question and says, you know, okay, there's something there, we can actually have a conversation about it and talk about it. So that's really, it's good stuff. I mean, we are the ones that ultimately make the decision, but we collaborate with many, many folks.
Absolutely, absolutely.
I
Yes.
didn't think I was going to be excited about this. But well done, you guys. So at first I was thinking, oh, Polk County needs one of these. But it sounds like we're completely partnering with St. Croix and Polk County's access. All the volume that we need will be just down there.
Absolutely. I personally do not see any reason that Polk County needs to spend this kind of money. We have them just down the road in New Richmond. I mean, that's going to be so much
So this will be
simpler.
in New Richmond.
It'll be New Richmond.
Oh,
Yep, it'll be in New
close,
Richmond.
right.
The one thing I wanted to say, we haven't gotten far enough along in our conversations to decide, talking about how much is it going to cost to do a virtual autopsy compared to a regular autopsy. Well, as you remember, it's $2,500 minimum to transport a patient in an autopsy. We're looking at $750.
And the other thing is, it can, right now, what a funeral home does is they pick up the body, go to the autopsy place, go back home, go back to the autopsy place, pick up the body and go. With this here, once we rule out, the scan takes 25 seconds. And once we rule out the fact that there's no trauma, and that's our big thing. We're ruling out that, okay, this person has a massive skull fracture and they were in bed. What does this mean? Those are the things that we got to look for. The fact that we have them in a sealed body bag gives us, we're not creating any fractures in integrity of our case. That bag will be sealed. And these are the things that we're working on together, is figuring out how our process and procedure is going to be for bodies that come in. So it's going to be awesome, but I think together we can figure this all out.
It has a lot of potential. I think we see it as, from a human standpoint, people are going to feel much more comfortable about allowing us to do a CAT scan on their loved one than go through the process of an autopsy if it's not absolutely required.
One question I had for the sheriff demands on staffing. Do normal autopsies have sheriffs on site? The question.
Sometimes we do. Sometimes we do. And those would be, I would say, either for sure the homicides, you guys, and it's not only that they're accompanying the body, but they're also giving information to the pathologist in real time that, they may not be able to see in my report. So
That's
there's
just built in for our staff. You're good with that.
So like you could have a case where it's just a unexpected death. But in this home, there is a history of maybe physical violence, maybe all these here things. And you're not doing an autopsy because anything looks hinky. You're doing an autopsy to rule it out because there's all this history. And with that cremation piece to it, it's more of it's really a CYA for the whole county or all our agencies to do that because there's so much history. Because that's part of our investigation. This way here, we can be at some of these places that they do literally have a natural, unexpected death, but we didn't need to do an autopsy. We could have just ran them through the scanner and said, there's no trauma here. There's nothing here.
And it's common, a year later, a family can come back and make allegations, and if
Yeah.
you've crossed all your T's and dotted your I's, it's easy to alleviate those concerns.
And it's always after they're cremated. And the same, and it's always, and family dynamics are interesting and complicated. And especially with our elderly population, there are people that are in that caregiver role. And then there are those that live on either coast or whatever. And then when the person dies, they come back and family dynamics causes things and finger pointing starts. So we'll be able to have this here, CAT scan to be able to and put as part of our caseload.
Thank you for coming.
Oh, not a problem. John and I are super excited about it.
Thank you, Patty. Thank you, John.
Thank you,
Thanks.
Patty. Appreciate it very much.
Grab your dump frame right out of the wall right over there.
And the waters.
And, yeah, by the
Oh,
water.
jeez.
Thank you. Oh,
That's what I thought about.
Oh, yeah, yeah.
All right. Rita, do you have a question?
oh, I just found it very helpful and I just wanted to thank them.
Yeah. Next one would be resolution.
It's part of-
Oh, question.
I have a question
Go
for
ahead.
John. John, how many of those deaths were COVID?
From my standpoint, well, I think we were up to probably at least 50 from my standpoint that I would see. And, but you have to remember, if I get involved in it, that means that they had to have died in Polk County. Could have been at one of the hospitals. I had unfortunately, more than 2 handfuls of people that died at home. Suddenly, relatively unexpectedly. They may or may not have known that they had COVID. In these particular cases, in at least a handful of cases, I mean, we went in ages from 30 to 70 at-home deaths, COVID. The younger ones, the 30 and 40-year-old men, and they were all men that died, never were tested, never went to the doctor. They thought they had COVID. They had exposure to COVID. They had symptoms of COVID. So in their mind, they had COVID and they were gonna let it run its course. And as we know, with COVID, it doesn't just run a normal course. It can take a huge dramatic change almost overnight, and that's what happened. So we actually, I would actually test these folks, the men that died, in particular the younger ones at home. I would actually get a nasopharyngeal test swab, and we had a really nice setup with a Gold Cross transport out of Eau Claire that I would take the swabs that I received from the state lab of hygiene, call Gold Cross, they would come up that night, pick up the specimen and have it down to the state lab of hygiene the next morning. And by the next day, I had a report. So within 48 hours, within that 48-hour time period, I had a report of a confirmed case. That was something I've never done before up until this year, 2021, I should say. Thank you, Arnie.
Well, the reason I asked that question was in the one time in the one of the local papers, 1918 pandemic, 50 people in Polk County perished from that disease. And I don't know what the population of Polk County was in 1918. Somebody here in the office may be able to
Not me.
figure that out. But I think it's just, I mean, I think we just have to deal with historical facts, whether and compare them to the 1918 pandemic and this particular pandemic for what's happening in our county, because obviously our population is greater.
Well, we've had 106, I just looked it up, residents who have known to pass from COVID.
Okay.
Not all of them go through John's office,
Correct.
they die over in the cities or somewhere else. So it'd be interesting.
How many residents, Tanya?
106.
Sorry.
Oh,
We're ready to move on.
Resolution 1122. Resolution supporting elimination of badger care eligibility.
I think Mr. Olson presented this. I'll let Aaliyah address the specifics, but I think this is something where he identified what he perceived as a need and wants to consider this resolution as kind of a lobbying resolution to encourage the state legislature.
Right, so this is, I blatantly plagiarized this from another county. I obviously changed the name of the county in the resolution, but it's something that's going through a lot of different counties, to my understanding, where there's this perceived point in time when somebody who is on Badger Care Plus, so earning an income, and then their income rises just slightly and it cuts off all of their Badger Care benefits. Now, there are other things in place that can, on the marketplace and other things where folks that have that situation can work through it and maintain coverage. But this is something that Supervisor Olson wanted. And again, it is going through a lot of counties. It's a lobbying resolution. And so I think it speaks for itself. It's pretty straightforward in its concept. It's asking the WCA and the legislature and the governor to look at changing the moment in time when eligibility for Badger Care Plus would end, and having it be a bit more gradual so that as you earn more income, it only slowly increases the amount that you're going to pay for your Badger Care until at some point it does go away.
Well, this would essentially do this as opposed to.
That's the theory behind
A
it.
hard stop. This is a graduated stop as opposed to a hard stop.
Right. That's what Supervisor Olson wants to promote, and it is something that is going around a lot of counties. So I think Pierce, Barron County is the one that I plagiarized, and they do some strange things in the resolution. So I took out a few of the paragraphs, but other than that, the language, it's pretty uniform in the ones that are going around from county to county.
Originated in Barron.
Did it originate? When Supervisor Olson reached out to me, he said something, I think, about Pierce County, and I tried to find it, and I did find it mentioned in an agenda, but I couldn't find a copy of it. So then I just Googled, and Barron was the first one that came up. It's obviously before your committee because it's the Health and Human Services.
Well, I think it's a good idea because I think that we certainly can use some of our seniors to be working, even if it's a few hours a week or helping out in some way. For that.
Well, and this isn't a Medicare, this is a Medicaid. But yeah.
So this is okay that I speak.
I mean, Mr. Chair.
Go for it.
All right. So I think it's important for the board to understand that the Badger Care is not going to affect our elderly population, the 65 and older, or our disabled individuals. They are part of the Medicaid program. Badger Care is going to be for our childless adults up to age 65 who are not disabled, and our families. So our caretakers that have children under age 19. So another piece that I think is important, that this resolution really is about our childless adult population. As the Badger Care program does have phase out already built in for a large population of individuals on Badger Care. Our childless adult population, over the years, sometimes they're covered on Badger Care, then depending on our administration at the state level, they will not be covered, and then they're covered again, and then they're not covered. So we weren't real, as economic support, we weren't really privy to this resolution until I got asked about it. And so as I did research, and it really is about that childless adult population. Their income limit is 100% of the FPL. So when you put that in the dollar amount, a household of one, their gross income limit, if they currently exceed $1,132 a month, they're going to lose their Badger Care coverage. So as a household of one, that's not a lot of income, is where our families, they have the ability to phase out of Badger Care based on their income over a period of a year. So if you have somebody that is under a certain 100% of FPL and they find employment and they have a whole household, they can find employment, and then we can still cover them on Badger Care for up to a whole year. So they have a much longer time to potentially go on employer-sponsored health insurance or go to the marketplace for private insurance. So I don't want people to think that Badger Care is just, you hit an income limit and you're done. We do have buffers built in for a majority of our population that are on the program. It's just that there is a group that is, we have a stronger line in the sand for
This
them.
gives us buffers for that other group that you're talking.
Yeah, so our children, our caretakers, our pregnant women, we have these extensions built in and much higher income limits for them to potentially phase out of the Badger Care program. And then we have gap fill, which, so we look at income monthly, but if somebody is over an income limit, we can look at them on an annual income. So that's like another buffer that does affect that population. It affects people that are temp workers and maybe go from assignment to assignment or are laid off for a period of time. We have a number of self-employed people who their self-employment business has just not worked out. So we've been able to look at an annualized income for them to potentially cover them for the remainder of a fiscal year. Our seasonal people, again, we can look at annually versus monthly. So there are a lot of buffers built in to try and keep people from falling off and not taking work because they need that type of the Badger Care coverage. So I just wanted everybody to kind of understand that, because I think it's important if you're going to approve a resolution that you have some sort of an understanding how the program really does work.
No, I think that's great.
Thank you.
All right.
So, Diana, is your recommendation that this will help that little gap that's in there?
I would hope that the resolution that's being presented would put some buffers in place for our childless adult population. And quite frankly, a lot of those individuals here in Polk County are served by our mental health clinic. And so it would benefit them to have some sort of a transition.
What ends up happening, if I can, Diane, is these folks will, we promote, let's say, take, a certain population, we promote people to get work, right? So they work, they lose their Medicaid benefits, they're not able to continue to get services and have that support that will help them live independent and productive life. So will be very helpful.
Yeah, and dollar wise. And so I think this is a big piece that people probably don't understand. We don't have our 2021 data yet for Medicaid expenditures for the state. We don't get those until April. But for 2020, our Polk County's Medicaid expenditure was $65,172,000. So that's just Polk County. When we look at our 10-county consortium, our Medicaid expenditure was $720 million. And so when the state is going to look at this resolution, they're going to have to really look at the fiscal aspect of how they can afford to add a whole nother layer of that on top of Badger Care.
She should put them up here. Plagiarize.
And it did originate out of Barron County. Yes.
Which is what they teach you in law school, how to plagiarize. So I'm just doing what I can.
Very good, thank you.
Ready for a motion?
Gonna go for one more. Identify subject matter for April 12th. meeting.
Oh, no. Do we know if you want a motion on this? You want a
Oh,
motion?
yes. What am I thinking? Yes, we need a motion.
Okay, I move that we support resolution 1122, the resolution supporting elimination of the Badger Care eligibility cliff for adoption.
I'll second it.
All in favor? Aye. Yeah.
Now you can move on.
Now you.
Subject matters for the April 12th meeting. You guys are gonna get a special treat because I'm not gonna be here.
Me neither.
That's when you sneak everything in, everybody.
Right, so will we have new board by then?
Yep.
Okay, well, I'm gonna miss that. We're gonna bring back Golden Age Manor, Child Support, Veteran Service, so they'll kind of be driving the April meeting with their updates for you. Division Strategic Plan update, I would table that until the next month, and we'll receive our new members and start schedule our orientation, which I think is beneficial for everybody to have orientation. So we do it right before our regularly scheduled meeting in June. It starts at 8:30. Unless there's other things that we need to add on as we move through here, we can add those on. But we'll be blessed with Dana, Nikki, and Andy as your presenters.
And who will do the orientation?
Well, that's in June. That'll be.
Oh, that's in June.
That'll be
Okay.
all of us, actually. We'll all come and teach you about what we do
Got it.
and what your role is.
Thank you. Thank you for telling us.
Yeah.
I just want to make a comment that this is my last meeting. And when I come on this board, there was nobody wanted to come on. And I really enjoyed it. I think this is the most informational meeting that I have been to on the whole time. It's very special people. I thank you all.
Thank you, Joe. Thanks, Joe. How many years of service for this
8
board?
and a half.
Is that your entire duration on county board? You've been with us?
Awesome.
Thanks, Joe.
It's kind of nice that you got to chair the last meeting then. for you.
Yeah.
Please keep tabs on John Bonaprice.
Yeah. Not feeling too good.
Hey, sorry, Joe.
Go ahead.
Fran just thinks we have one left in April that the new board doesn't take up until the third Tuesday. So maybe you are stuck one more meeting.
We're
No.
second Tuesday.
Yeah.
But when is the election? Let's see.
Yeah.
So it is 1 week after that.
Don't they have a new member thing that come in right away and they
Brand's
vote on it? Goes to what committee?
I think we'll have an organizational meeting right after the election, and then we'll have our normal.
All right. That's fine. So they do have one more meeting? Yeah.
They see the picture.
We'll have an organization meeting. We'll want to set that up.
If we can do that with them, then I can be a part of it.
Right after the election. But how would that work? Because we have the election on Tuesday, the 5th. Then this is on the 12th, but we won't have, the board won't have gotten
Right,
together
there
to
won't
assign
be,
where they
so
go.
there might not be a meeting on the 12th. It might have to, we might have to, we'll talk about it.
Maybe let's postpone that.
Yeah, postpone until later.
Or
Yeah.
if you're the only person who won't be here.
But then there's people not on the board anymore, so we might be down people. If some,
Might
we
be.
might not have enough people, depending
Right,
on.
that's what I'm saying. That's why I'm thinking maybe.
Might not, but we might also have it. I mean,
Or you just.
We'll figure it out.
Okay.
Don't you worry about it. Staff's got on
Seems like
it.
we've been doing it
for the last 100 years or so.
I mean, we could plan on having the meeting then, unless there's a major shift in people that we say we won't have a quorum, but if we have a quorum.
I think we're getting 2 new members on this.
As long as everyone else.
Going for it.
Also known as Fran. Okay.
Okay. Go for it.
You want to take the honor? It's your last meeting.
But I did that highway too. I make a motion to adjourn.
I have to tell you, Patty Schachner, a few years ago, I had her come in and speak at one of our church women's groups. And she told a story about this family where they had gotten a call. This is kind of depressing, but I remember it all the time.
because you had asked about alcohol abuse, and they had gotten a call, they got to the house, and this woman was in the bathroom, passed out, sitting on the toilet, leaning over to the tub. But her little children, but she had passed away. And the little children, nobody called. Her husband didn't call. She was there for like the day. Nobody paid any attention because it was normal for her to do that. And she was telling some of these things they see and experience. And what happens with the children with drugs and alcohol is just awful. And you don't hear it, I don't see it, you don't hear it or see it so much. But when she was talking about this, and that's probably 5 years ago, she said this, and it's clear in my mind what she was saying because it was so awful. But all right, Joe. Thank you.
Yeah.
On the way.
Terrific.
There you go.
Great. Wanted to,